So, Commissioner, I'm grateful to you just for this opportunity, just to be able to chat about your experience leading the state's response to the pandemic. I know it's a lot. It's pretty extraordinary. And so, as part of this project, which we're calling Community Conversations, it's New Jersey's COVID-19 storytelling project in collaboration with the New Jersey Y State Alliance. We're trying to learn, hear, listen to stories of people's experiences of the pandemic. Really want to make sure that the story of the Department of Health is included in that process. We had a role in that story, and of course you as well. So I am recording our conversation, and so I'm just gonna ask some questions. Yeah.
Sure, go ahead.
the first question whenever we start an interview is just like, how are you today? Like, how's everything going?
Well, we're seeing some light at the end of the tunnel today. So I sit here, we're still in the pandemic. We still have cases, but we have done a remarkable job at getting shots in the arm. That people vaccinated, almost 4.7 million people in New Jersey have received at least one dose, and I think about 3.6 million have finished their vaccination series. And it seems to be working. We're seeing decreases in cases, particularly in places like long-term care. And overall, positive cases are down. So how do I feel today? I feel hopeful. I have felt hopeful before. I felt hopeful last August when we had our lowest cases in the hospital, and our positivity rates were low, and it looked like we were coming out of this pandemic. And then we were surprised because this virus mutates and came back, and you start taking it personally. It's like once you visualize this warrior virus, then you really get very focused on how to beat it back and know that it can always come back again. Mm-hmm. And that's where I am right now. I'm going to beat you back. If we have to do it with vaccination, and if we have to do it with booster shots, we will beat you back. But we will never let our guard down, because we know that you are a really resourceful warrior and you will come back. Mm-hmm. Maybe you'll be, endemic, always around, with peaks and valleys. We do know by history pandemics do have an end point. Usually it's a year and a half. This is going on longer. Yeah. So this is a really different pathogen that we're dealing with. Mm-hmm. And there'll be more. And we must learn lessons from this. So right now I feel okay. My PTSD is there though, mm-hmm. from those dark days. Mm-hmm. You felt so responsible.
How so?
So responsible. It was hard.
Yeah. No, I hear you. I mean, could you describe that just a bit?
Well, we were working 7 days a week. We got our first case March 4th. I was in Florida to celebrate my birthday with my twin sister, which I always do. I landed in the morning, got the call at 2 o'clock that we had our first case. I had dinner with her and flew home at 5 a.m. the next morning. And from that day forward to at least Memorial Day, we were in the office 7 days a week, 8 a.m. to 8 p.m. The team here was remarkable, extraordinary. I was never by myself. I was in here with a team of people, and we just were knocking through what waivers do we have to put in place, what emergency directives do we have to do in place to allow the whole healthcare system to be agile and resourceful and to pivot on a dime. If you were approved for 10 critical care beds, you can put in 20, 25. You can put up tents to increase your license capacity. That was hospitals. Mm-hmm. And long-term care, we decreased all of the barriers to bringing in new certified nurse aides to take care of people. And in the midst of all of that, we were struggling with the state police and the emergency management individuals to find protective equipment. In my lifetime of working, you never could think that you couldn't get a mask or a gown or gloves, and we couldn't. And we were moving ventilators in the middle of the night, so we used the Emergency Health Powers Act to separate out the state into 3 regions, and we named the trauma one, the level 1 trauma centers, and we gave them the authority to move patients, to move ventilators, to make sure everybody got cared for. And everyone did. But we were overrun with, at the height, in our hospitals, approximately 8,300 cases of COVID in our hospitals. Approximately 2,300 of those individuals were in critical care on ventilators. At one point, 97% of them were on ventilators. The death rates were surging. The virus was surging. And we were working as hard as we could to get in mitigation activities. We need more contact tracers at the local level. The local health department infrastructure had been decimated for years, decades maybe. And we needed to train contact tracers, and we called upon Rutgers. They helped us with the training. And then we employed a third-party vendor to use that training to onboard people. We onboarded 3,000. We deployed them into the local health departments for case investigation, contact tracing, because the only way we were going to get ahead of this was mitigation. And then testing. We weren't approved for testing till March 17th. We had our first case March 4th. And then we were approved very little. There were no testing kits. So we started slowly building up testing capacity, opened up some mega testing sites. We opened up at 8. By 10, the tests, we were done. The lineup of cars, and it was. And then when you were symptomatic, we didn't know about asymptomatic spread back then. We needed a place for you to safely isolate and quarantine if you couldn't do it at home. We have the 10th or 11th highest number of multi-generational homes in the United States. People could not isolate safely. So hotels were closed as part of the response, the public health response. Hotels were closed. We commandeered hotels and we set up hotels for not only exhausted healthcare workers who needed respite, who were working 16 hours a day, sleeping for 8, going back for 16, or couldn't safely isolate at home, or were fearful they would be bringing COVID home. So we set up hotels for them, and we set up hotels for individuals who could not safely isolate at home, and many, many, many of them were homeless. 24 hours a day. We felt so responsible for every single resident of New Jersey, no matter where they were in the spectrum of this pandemic, whether they were safe, whether they were exposed, whether they needed care, to whether they needed support at the end of life, because the medical examiners are part of us. And we ran out of refrigerated trucks. And we were trying to get more refrigerated trucks. Remember, New York and New Jersey got hit first. We imported nurses from, Colorado because they were not getting hit. And I think everybody at that point in time thought, oh, this is a New York and New Jersey phenomenon. Well, turnaround is fair play.
Yeah.
When we started going down, other parts of the nation started going up, and we hopefully supported them as well. I know we sent some ventilators to different states, but it was a constant, overwhelming exercise, only made tolerable by the resilience of the staff here. And we always found a way to walk out smiling. At 8 o'clock at night, sometimes singing. We used to sing the song, "We Gotta Get Out of This Place," if it's the last thing we ever do. We sang it on the way out at 8 o'clock every single night. It was hysterical.
Yeah.
But we had to.
Yeah.
It was survival.
It was survival.
Yeah.
Yeah. Can you unpack sort of like that resilience a little bit more? Like what else did it look like? Like what does resilience look like in that space?
Well, the resilience, every day we were hit with something else.
Yep.
And we had to say, who do we have within the department? The most life-giving experience for me was the people that rose up. The potential that we saw in people working at the department that maybe, and I use this term loosely, hidden in quotes, in other parts of the department who could, other parts of the department who, paid attention to their own little public health whatever, and they stood up and did really, quote, miraculous things.
Can you give some examples?
And the potential of it. Kelly Anderson in EA, in integrated services, is our testing czar. And Kelly just taught herself everything there is about testing. She has national prominence in that space. Thalia Serkiu, our deputy chief of staff, or deputy, or whatever, I don't know people's titles, I'm terrible at that. I said, you got to do this thing with contact tracing and set up a COVID NJ alert app. She did it. Robin Ford. Robin Ford's our finance person. She set up all the hotels. She got volunteers, physicians and nurses. She got people to donate food. She did it all on her own. And then my deputies, Andrea, Marcella, Deb Hartel, oh my gosh. Every single day, 8 a.m. We first had to teach ourselves how to make the coffee. That was a big thing because we never knew how to work the coffee machines. We made the coffee. We started our day at 8 a.m. We walked out singing at 8 p.m. and pivot. Everybody using every bit of knowledge and experience they had amassed in their careers, myself included. So Andrea knew the ins and outs of state government. Marcella knew the ins and outs of waivers and executive directives and what did we do during Superstorm Sandy? What can we do? What can't we do? Deb Hartel, like myself, experience on the outside in hospitals. What about licensing? What about regulations? What do we have to loosen up? What do we have to keep tight? What do we have to keep safe? It was every day. When I tell you we had a war room with posters up and we were constantly, in fact I've saved all of them, because it showed the progression of our work and how we went from, all right, we did this, now we have to do that. All right, this worked over here, but we have to do something different over here. It was overwhelming, but the resiliency, the ability to pivot, to meet every challenge that was put in front of us, they did it.
Yeah.
They did it. For a leader, it was life-giving, but more so to be able to now see a little bit light at the end of the tunnel and see the growth in individuals, the potential in individuals. We have our next bench of public health leaders right here in people that showed up, participated, did things they never thought they could do. And I used to say in my career, difference between me and every other nurse, every other 150,000 nurses in New Jersey, is I was given opportunity because people saw in me what I didn't see in myself. I think we saw what I bet some of these people never saw in themselves. So Rob and Thalia, and I don't like to name names because there's so many people behind the scenes. Jen Fearon, policy, she jumped into vaccines and, with absolutely fearless about talking to the feds about what we need, what we don't need. Manaz Mustafa, taking her epidemiology background, which was never tapped here. She was in the shadows. She's now head of an analytics group that is just, well, she doesn't have her group yet, but she's head of analytics that is presenting information at such granular level that will save lives. So I could just go on and on. Yanai, this fella named Yanai. Hey, Yanai and Natasha. So what do you do with Yanai and Natasha? You tell them, you got to go into the most difficult municipalities and places and make a difference. And you did. You know, every time I think of Natasha Rosario knocking on doors of the county jails to say, we need to test your inmates.
Mm-hmm.
I need to talk to the warden. And she did it.
Mm-hmm.
And Yanai going into Lakewood and using who you are culturally to encourage people to do the right thing, to test, to isolate, to quarantine, now to vaccinate. Yeah, we've sent people and said, well, we know this isn't your regular job. This isn't what you signed up for,
Mm-hmm.
but go out there.
Mm-hmm.
And I think this is probably the first time Department of Health at certain levels, because we rely so much on the local health departments, have been out there. Front line, face to face.
Mm-hmm.
Everybody.
Mm-hmm.
And I don't want to forget the local health departments. They have been, their work has been extraordinary as well. Talk about on the front lines, everybody bombarding them every day with questions about some things we had no answers to. What a terrible situation to be in. So what we all learned was how to lead through ambiguity,
Yeah.
which is the most difficult thing to do. So you have to stay close to the mission. Our mission here was to prevent morbidity and mortality from this COVID-19. And whatever we did,
Mm-hmm.
we'd have to ask ourselves, is this preventing morbidity and mortality? Is this helping to prevent morbidity and mortality? Because we didn't know whether it's the right thing or the wrong thing sometimes. But we did have a straight line to the people who were most affected, I think.
Mm-hmm. Yeah, no, I hear you. I mean, I think that's very much what I think kind of we witnessed here is that always being the driving question, is how can our actions genuinely be helpful in real life and reduce mortality and morbidity. Are there areas where you feel like we struggled?
Well, long-term care was a struggle for lots of reasons. We did the right thing with long-term care. We started universal masking, curtailing admissions in long-term care facilities that got hit. What we didn't know was what some people on the federal level know, i.e. the president, that this was highly transmissible. You just breathe is the quote. But we didn't know that.
Mm-hmm.
He shared that February 7th.
Mm-hmm.
If we knew that February 7th and the whole state and nation locked down then, I think multiple lives would have been saved. So yeah, we didn't know a lot about this virus. Mm-hmm. So I look at long-term care and say, what should we do structurally to transform our long-term care industry to be more safe? What is it about semi-private rooms or more than 2 or 3 in a room? What is it about the staff? How do we make sure that they understand infection prevention policies and practices? We have to do things radically different. And I think we will. Will we be able to transform long-term care in a vision that makes it better and safer? I think to some degree we will, but I think that there are such issues with reimbursement and how you do that. I wish we could have all private rooms and more registered nurses to supervise in a positive way, to teach and educate, because we're taking certified nurse aides and they are the lifeline to those patients. They deserve more in the what I call the one-on-one kind of real-time instruction. It's different from sitting in a classroom and getting certified. So how do you translate that to the bedside? And they need quote-unquote instructors to do that, and we don't have that. We throw them in. They are the companions of the people in these long-term care facilities 24/7. So there's a lot I think we can do with that. I think we did as much as we knew to do when we did it.
Yeah.
But again, if we had locked down sooner, I
Mm-hmm.
think we could have mitigated a lot.
Mm-hmm. Mm-hmm. Yeah.
So-
No, I hear you. I mean, from part of the purpose of this project really is sort of kind of drawing out lessons learned, like for the future of public health. Are there other points that come up for you around? These are places where we really have room for growth in public health.
Again, building up the infrastructure at the
Yeah.
local health department.
Yeah.
This just pointed out that people don't understand public health, so
Yeah.
they turn to the experts, and we didn't have enough experts in the field.
Yeah.
Should I test? Should I not test? When it's positive, who quarantines? Who this? Who that? That all came from our communicable disease service, the guidance. But translating that guidance again into the community is quite difficult.
It's quite difficult. Yeah.
And that's a big lesson. Big lesson for me
Mm-hmm.
is public health is not reserved for the degreed individuals in public health.
Okay, tell me. Yeah.
Public
Say
health
more.
is everybody's responsibility. I have such respect for Office of Emergency Management.
Uh-huh.
Such respect for the state police.
Uh-huh.
Oh my goodness. When we could not have done this without them.
Yep.
And Colonel Pat Callahan
Uh-huh.
became a fast friend and support to the Department of Health. We could not do it without him. In the middle of the night, he'd call me and say, we need to get a ventilator, and boom,
Yep.
we worked it out. I didn't see their role in that. I told him,
Mm-hmm.
the role of the state police to me were the lights flashing in back of me.
Uh-huh.
All kidding aside, the state police, I can't say enough great, and OEM can't say enough better things about them. We could not have carried out testing and vaccination without them helping us with the mega sites. The Army Corps, how did I know we could call in the Army Corps to set up field medical stations? Oh my goodness, they're unbelievable. In 5-6 weeks, they transformed our bed spaces that saved lives.
Mm-hmm. Mm-hmm.
And then the state police and OEM are just so high on my list. Public health is everybody's responsibility.
Mm-hmm.
And that is eye-opening
Mm-hmm.
and energizing.
And energizing.
Yeah.
Mm-hmm. How so?
Well, when you know you're not alone,
Yeah.
the minute I knew that I could rely on Colonel Callahan, I didn't feel so alone in my job.
Mm-hmm.
I knew he had my back and that we would figure it out.
Yeah. Yes, if you know that the state police has your back, that's a good
Makes you feel
feeling.
better, doesn't it?
Makes you feel better.
Better. And
Yeah.
then we had a governor that really, I say he jumped, out of the surgical arena right into this, and he actually did.
Mm-hmm.
We can't forget that.
Mm-hmm.
And so we have a governor that it looked at the science and the data and never overstepped.
Yeah.
And that, from my perspective, was really a big support. I can honestly say that he never outwardly questioned what we were doing. I think he understood on a gut level that we were doing what we needed to do based on the knowledge that we had. And he always wanted that knowledge as well.
Mm-hmm.
And he never hesitated to reach out to his contacts to get that knowledge. But overall, you'd be remiss to say
Mm-hmm.
that without the governor that we had in Governor Murphy, I'm not sure we'd be where we are right now. I'm not sure we would have made the decisions that we made. And some may say, well, look what happened with long-term care, and we have one of the highest rates of mortality, and that's all true.
Mm-hmm.
We are by far the most densely populated state in the nation.
Mm-hmm.
And we have incoming travelers from, New York, Philadelphia, and Newark, international airports. We have diversity that is so rich, but also leads to a lot of travel, nationally and internationally. So, if anybody else had the challenges that we particularly had, density, multi-generational housing, significant travel in the very beginning when we knew very little about this virus, I don't think there was another state that had the challenges that we had.
Within those challenges, are there specific populations that you feel like kind of weathered the worst of it?
Oh, absolutely. Our communities of color, this just pointed out, shone a light on the health disparities and inequities that we know have existed for years. And it's even more so. Many of them are multi-generational housing. They were essential workers. They could not stay home. They were needed on the front lines, whether it was in food production services to make sure people that there was food on in grocery store shelves, or whether they were helping to support hospitals and long-term care. They could not stay home. So they were exposed. So the disproportionate impact on, for example, young Hispanic men, 3 times more likely to die of COVID than white counterparts, and African American Black men and women 2 times as likely to die from COVID-19 than their white counterparts. The disproportionate impact is overwhelming.
Yeah.
So we are really focusing our vaccine efforts right now in that direction. We're doing better. Part of it is not only building awareness, but bringing vaccines to places where they feel safe to receive the vaccine, and then to dispel some of the long-standing and understandable hesitancy, particularly among the Black population, in regards to what they've experienced with clinical trials, Tuskegee being at the top of the list. So we have our work cut out for us. To me, that those vulnerable populations are the ones that we owe a lot to through this. And it should change our response going forward to making sure that their access to good and appropriate health care and prevention strategies are highlighted, emphasized, and delivered.
Yeah. Can I ask how so specifically? Like, what would your recommendations be?
Well, I think it goes back down to local public health. Our federally qualified healthcare centers need to be appropriately staffed and supported and funded. All community health strategies need to be strengthened. How do we take care of people in their homes, those that are homebound in our in our cities and towns? Public health nursing needs to be strengthened.
Yeah, I hear you. Do you have another like 10 minutes or so, or what's your?
Just about 5.
Just about 5. All right. Well, we'll see. But
hit the highlights.
I'll get the highlights. You answered a lot of my questions. It's funny. One of the first questions on our list is how did your life change in March 2020? I feel like that's no, but I guess. Well, I have one more kind of like specific population that I wanted to ask about, because I know that it's close to your heart, and then maybe just kind of tie up with some final questions. But when I've really learned a lot from the level to which I know you care for and feel close with people experiencing homelessness in the state. I know that's many experiencing homelessness in the state,
yes. And
I know that that's a long-standing relationship for you. That didn't start during this pandemic. Can you talk just a little bit about that connection and the support in that space?
Well, the whole issue of homelessness, to me, from a public health perspective and just from a humanity perspective, is overwhelming. Why in the richest country in the world do we have pockets of homelessness? And I don't I don't subscribe to some people want to be on the streets. What I do subscribe to is if people are on the streets, they deserve the same dignity and respect and care that everybody else gets.
Mm-hmm.
So in the very beginning from this, and I know Yana, you were very involved with this, the homeless shelters were very important collaborators with us. I've been associated in some way with the rescue mission in Trenton, being on a foundation that supports them repeatedly. The work that they do to me is just, take care of the least fortunate among us, and you see the real heart of a community. This expanded during this pandemic to include particularly women and children in our domestic violence shelters. In a certain respect, they are homeless.
Yeah.
And fearful.
Mm-hmm.
So I wanted to make sure from the very beginning, whether it was testing, which is all we had before we even had the vaccine, that they got as much access as anyone else. So I think we worked really aggressively. Yana, you were involved with that, and Natasha, and trying to determine, particularly in the homeless shelters, how can we reach the most with the best. And I remember our excitement when we knew we could get an antigen test, so we could go at dinner time and test them on the way in. And surprise, surprise, they were very open to being tested.
Very open to being tested.
Oh, very open to being tested, as they are open to being vaccinated.
Yep.
So the same process that we used for testing and it's not only homeless, by the way. I have a big soft spot in my heart for seasonal workers, migrant workers, because we really focused on them as well. Not only testing, but also in vaccinating, and relied very heavily on our FQHCs in that regard, and they did a great job. You can't, any one of us should not look at our lives and think that we're any different than anyone out there. We're not. We've had opportunity. We've been beneficiaries probably of great opportunity when you think about it. I have a roof over my head. A lot of us do that are here, or most of us do that are here. But as we used to say all the time, people are maybe one mortgage payment away from being on the street. And I think through this pandemic, for the number of people that have lost their jobs, the relief that has come from the federal government has been life-saving, or else our homeless shelters probably would have been overwhelmed. How we take care of the people that are less fortunate than us is just a character of a town, a city, a county, a state, and the nation. And shame of us if they suffer more than others through this pandemic and going into the future. I think we learned that the migrant workers very open to being tested and vaccinated. Sometimes the owners not so open, the owners of the farms and stuff, and they needed more education. So I've done over what I call 150 stakeholder calls, 10,000 people. Anybody that wanted to listen to me, anybody that wanted to suffer through listening to me, I was on a call, whether it was 6,000 or 7,000 people, to increase awareness and educate. Because we really felt that our program was based in 3 buckets. Awareness, build awareness about the pandemic, about this virus. Educate. There's a difference between awareness and educate. Awareness is, oh yeah, that's out there. Educate is, oh, here's what's behind it.
Yep.
And then action. So awareness, education, and action is really it's kind of what we followed. Whether we were talking about testing or vaccine or isolation and quarantine, let's raise awareness. Let's educate to what we need to do, and then let's do it. And that, whether it was, again, migrant workers, homeless, homebound, whatever, we use that same process. And I think it sat well with us. It brought us back to not focusing on extraneous details, because you can really get called away and not waste time, but spend too much time when you had to work in 24-hour increments to save lives.
Okay. No, I really hear that. All right, I'm gonna end with a final thing, because you talk a lot about kindness. You talk a lot about the importance of kindness. So just to end, would you be willing to describe ask one act of kindness that somebody did for you during this period, and one act of kindness that you were able to do for someone else during this period?
Now I'm going to have to really think. There's been so many acts of kindness. Some of the emails that I've gotten from people have been just remarkable. And at some of my lowest points, when I would get one of those emails, it would really lift me up. So it's hard for me to say one act of kindness. Is it the ice cream? People know I love ice cream. The ice cream that the team brought in when I needed it the most.
Nice.
Something like that. The kindness is an important message. So I'm going to give you a little anecdote that just happened, so it's fresh in my mind. It taught me a lesson.
Yeah.
It's about thank yous.
Yeah.
It's about thank yous. I was at a restaurant just 2 nights ago with friends, standing outside, waiting for my table outside. And my friend's husband said, "There's a group of people to your right, Judy, that are like staring at you. I think they recognize you." I said, "Oh, I hope they don't come over and, criticize us for masking," because that's the usual. And the fella came over. He said, I need to say something to you. So I said, "Yes." He said, "I want to say thank you." And I thought, well, isn't that great? I said, well, gosh, I really appreciate that. So I thought he was thanking me for the pandemic, right? He said, "I want to say thank you. 15 years ago or 20 years ago, I don't know how long ago it was," he said, "you were the president of St. Francis Medical Center, and I was visiting and I got stuck in an elevator on the basement floor. And when you heard about it, you came down to the basement to give me support till they got me out of the elevator." And I was stunned. And I said, "Well, thanks for sharing that. I do vaguely remember that." But it was the lesson of saying thank you. So that's kind of an interesting twist to what is important. It's important to support people, but it's even more important to say thank you. So yes, kindness. Everybody here at the department has been kind to me, in small ways, in big ways, in ice cream ways. So yeah, thank you. That's the biggest thing. And on the other hand, I would just hope that, I have bad days, there's no getting away from it, but I would hope that at the end of the day, I try to leave and say thank you to the people that have worked around me. Thank you to the CEOs of our hospitals that could not have bent over backwards any time I called them. They helped. They did heroic work. They pivoted when I asked them to pivot. They went into different areas, again, that they had never gone into. Talk about kindness. They never once pushed back on me. These are relationships. The value of relationships is another lesson, right? That I've built up, and they've built up over the years, that are kind. They didn't have to be that kind. They were under unbelievable stress. So, I experience kindness every day, and I hope that I never forget to say thank you.
Thank you, Commissioner. Yeah, I think that we do experience that here.
That's it.
Very much.
Then I did like the ice cream.
Yeah, you did like the ice cream.
Mint chocolate chip, one of my favorites.
That's good. That's really good to know, Commissioner. I know you have so much.
Yeah,
I'm so grateful to you. just infinitely grateful.
Yeah, and I'll get some of that testimony to you.
Beautiful.
It's a helpful, but this was fun, and yeah, there's a lot. I mean,
There's a lot.
I don't even know, you know, one fifth of what we went through when
Yeah.
I think about it. But we did walk out every night singing that song. It was hysterical. It was hysterical. It was fun.